Starting your 2 minutes time. There are again 3 pages, okay?
Yes, ma'am. Yes, ma'am. Next page, ma'am. Yes, ma'am. Next page.
Started your 10 minutes time.
Good morning. I'm Divya, one of the doctors in the antenatal clinic today. Can I confirm your name and age, please?
Yeah, I'm Nola and I'm 38 year old.
Is it okay if I can call you Nula?
Yeah.
Okay, Mrs. Nula, I see from your GP letter that you are pregnant, and the midwife has little concerns regarding your height to weight ratio, and you're here to discuss regarding the management plan. Is it right?
Yeah, doctor.
Do you have any concerns and expectations of this consultation?
I would like to have home birth, doctor.
Pardon?
I wanted to have home birth actually in this pregnancy. I just wanted to be under midwifery care, but I don't know why they referred me here.
Okay, Mrs. Neola, your concerns are very valid, and I would be answering them in a while. But before that, is it okay if I can ask you a couple of more questions to know more about you and your pregnancy, and then we can plan a safe management plan? Is that okay?
Yeah.
Uh, okay, Mrs. Neola, can you tell me more about this pregnancy?
Doctor, this is my fourth pregnancy. Although I was not keen because my periods were pretty irregular, I was not getting it regularly. Since last 2 weeks, when I noticed that I am excessively vomiting, my breasts are little heavy. I did a urine pregnancy test and I came to know that I'm pregnant. Uh, Apart from that, my previous two pregnancies were normal. I delivered vaginally. My first baby was 3.4 kg, delivered on time. There wasn't any problem. My second baby aborted at 10 weeks, and my third baby was also delivered normally 2 weeks earlier only. The baby's weight was 4.6 kg, but I could able to deliver them normally without having any instrumentation.
Okay, Mrs. Neola, are you taking folic acid supplements?
Yeah, doctor.
Are you taking 5 mg, 5
Uh,
milligram, the high dose?
yeah, the GP
Okay,
has prescribed me higher dose.
okay. So, have you done your booking investigations and scan?
Uh, No, I have just been referred for the same.
Okay. So, um, do you have any medical diseases of concern that I must know, like high BP, sugars, and
No,
any clots?
no,
Have you undergone any surgery?
no,
Do you have any family history of concern?
no.
Um, Sorry to ask you personal questions. Do you smoke?
Yeah, actually, me and my partner both used to smoke, drink, but I have cut it down since I came to know that I'm pregnant. But my partner
Okay,
smokes
that
a
is good to
lot.
that is good to know. But however, smoking can be injurious even if the partner smokes in the same environment, family environment. So it's always better to quit smoking. So and, uh, the next time when you can come, you can also bring in your partner so we can talk more about that. Is that okay?
Yeah, doctor.
Okay. What do you do for a living?
I'm on community services. They support me.
So how is the support at home?
Yeah, I do have partner. He's my recent partner. We are there since 6 months only. I was not very keen for this pregnancy to continue also, but he's very keen. He wanted to have the baby, and that's the reason I'm oh, going ahead with the pregnancy.
Okay. How are you feeling? Have you felt low or depressed in the recent times?
No,
Do you have any allergy?
and I am having allergy. No, I don't have any allergy, but I'm having asthma.
Okay. So, I
It is
have you.
controlled. It is controlled.
So when was the last time you visited your a specialist for that?
Actually, I'm having occasional vaccination and occasional pumps I do take. So GP provides me that. I'm in regular
So,
touch.
may I know your blood group?
A positive?
Do you have any reservation? Do you have any reservations against transfusion?
No.
So, can I confirm your height weight ratio?
It's 55.
Okay. So, moving on to your, thanks for all the information, Nuala. So moving on to your concerns, s- uh, we see that your height weight ratio is on the higher side. So normally a healthy height weight ratio ranges between 18 to 25, but in your case we see that it is 55. So this has a few implications on you and your baby. And let me tell you what it has. Like for you, there are higher chances of miscarriage, and you chance of developing high BPs and also sugar, and the clots during pregnancy and after that. And also your labor, when you go into labor, there might be a delay in your labor, or you might need more monitoring during a labor, and also drugs to kickstart your labor, and also sometimes higher chances of surgeries. And after delivery, you might have little higher chance of bleeding. And pertaining your baby, there is higher chance that the baby can have some abnormality, and also the baby might grow big, and there is also a chance that the baby can get stuck after delivery. So I don't mean to scare you, but I want you to be informed about the situation. And so this might be the reason why you might not be able to have your care under the midwifery, and it is important for you to have frequent checkups. So you would have to come to the consultant led unit. Am I making myself clear, Nuala?
Yeah.
Okay, so would you want me to describe on what we would do more about this pregnancy?
Yeah, doctor. That means you are not going
So
to offer me home birth also.
uh, 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 your concerns are very valid. So let me tell you that because of the higher chances that in labor you might require monitoring and one-to-one care, and also the need for sometimes the need for a kicking start of labor, and after delivery also the chances of bleeding is more, which can be very life threatening. So in those cases, it is very important for you to deliver in in consultant-led unit. But may I know why? What are the reasons why you think you would want to deliver at home?
No, my partner is there at home. He keeps on drinking, and at a time he gets abusive with the kids. So I'm just worried that home birth will be a good option in that case for me.
You're very right that home birth is a good option, but however, because of these kind of complications, it is safe for you to deliver at our consultant-led unit. But however, if you feel that uh, that this kind of problem might harm you or your children, then I would tell you to have a emergency plan, and also we would also connect you to the safeguarding team, and also the to help you out with you and your kids. Is that okay?
Okay.
So moving on to the management plan for your pregnancy, I would first like you to do all the booking investigations and also the dating scan. And we would ask you to continue the high dose of folic acid and also vitamin D. And we might also need to start you on aspirin after doing uh, um, the nuchal translucency scan. We would also have to do the Down syndrome screening, and we would it is important for you to have frequent visits to the antenatal clinic, so we would have to keep monitoring your BP, and we would also have to do the sugar testing between 24 to 28 weeks, and we would have to do a serial growth scan because monitoring of the growth of your baby might be very difficult, and we would assess the uh, mm, clot formation risk, and we would be starting you on blood thinners. Um, am I clear so far?
Oh, yeah, doctor, quite clear.
So apart from that, we would also have to have a checkup with your the anesthetic doctor, that is the sleep doctor, quite early at around 34 to 36 weeks to decide more. I mean, have a more idea about you, and your care plan will basically be under a multidisciplinary team of doctors, which will include my consultant and the sleep doctor and baby doctor and the specialist midwife also. And we would be planning to deliver you under a consultant-led unit, and we would be providing you one-to-one care.
Yeah, doctor, thank you.
Thank you. Thank you for your time. I would give you written information and also connect you to the support groups, and book another appointment with my consultant. Uh, Thank you.
Thank you. Okay. Time management, little more precise time management you needed. That is my major feedback. Anybody wants to give a feedback, Muthulakshmi?
Ma'am, that concern for the home birth could have been asked earlier
Yeah.
because she told the same thing like complications, one-to-one monitoring, and all again the same. So it might
Hmm.
have been avoided
That repetition.
repetition because she might have revealed at that time
Hmm.
safeguarding is the issue.
Yeah. And could have been gone into that little more safeguarding. Okay. So
Yeah.
this is actually a task, although the answer key is not including, but I had included whether if it is a forceful, okay, if she is not ready for this pregnancy, so you shall I offer you counselor to decide whether to continue or end the pregnancy, because she said somewhere that I am not keen, I am already having a babies, okay, but my partner is keen now, keen on. Another issue is down screening, whether my baby is going to be at risk of down. Yes, 38 years, slightly more risk, obesity, slightly more risk of having a neural tube defect. Okay, so those risks are very high in this case, and 55 is in her BMI. So in RCOG, in the RCOG, although the answer key is not included that way, but RCOG says that these are very, very high risk pregnancies. 55 BMI is very, very high risk pregnancy. So in those cases, we at least she is early. Here you can very safely offer her medical management for termination. At least touch upon that topic once, because I told you I was not keen. My partner wanted to have this baby, but otherwise I was not keen. But then another thing is that she's in an abusive relationship. She's explained that he gets furious at a time. So really, she's interested to go ahead with this pregnancy. Hmm? So safeguarding and that concern is very important. Please keep it in mind. Don't go blindly. Don't go blindly. If the patient is giving you hint somewhere, somehow you ask that. One thing, one important point. Okay. Anybody, any other? Anything else?
Dietitian, physiotherapist.
MD physiotherapist, not actually physiotherapist.
So
Physiotherapist does not.
dietitian.
Dietitian, nutritionist, dietitian. No, means it will not be a calorie deficient diet. Weight loss will not be recommended during pregnancy. Those are the sentences what she need to say. But then there should not be extra calories. Okay, the calorie count. The dietitian will be involved for calorie count. Okay, she will needs to take exact calories if she continues. Okay, anything else?
Ma'am,
Concerns like
exercise
failed
BP.
epidural
Yeah.
and
She has addressed that. She has
yes.
addressed that. Yeah.
Ma'am, exercise BP apparatus.
We can ask
Equipments.
about mental health issues.
Yeah, here in this case, mental health is important, but at least postpartum mental health problems is very important, because social history, she's having very bad social history. So that PTSD and mental depression and all those complications, at least say in the post delivery complication. Equipments and
And
handling, she has
55
missed out.
Yeah, equipments and handling and anesthetic assessment at the third trimester.
She mentioned anesthetic assessment, but that equipment and handling missed
Mm.
out totally, which is again a very unsafe practice, because 55 you have to ensure that the hospital should be equipped with this kind of equipments.
Especially
Okay,
at
Dr.
BP
Anna?
curve. Mm.
Yeah. So equipment and handling is basically it includes everything, not only BP cuff,
Yes, ma'am.
everything. Trolleys,
Earlier,
labor table, the long spinal needle, everything. It includes everything. So say equipment, okay?
yes, ma'am. Ma'am, early IV access and
Early IV
difficulty.
access, yeah. Early IV access, difficult intubation, all those points. Dr. Anam, you wanted to say something?
Ma'am, 55, she is prone for bariatric surgery post delivery, no?
Yes, she's
40.
yeah, yeah, but then it is not our topic to touch upon that, but she will be under that MDT post delivery. She will be seen by the MDT for that bariatric surgery. So actually, here again, what she is doing for her weight? Is she undertaking any medication? Is she trying for anything? So that can also be asked.
This weight gain, previous BMI, previous pregnancy BMI, we should ask whether she gained weight suddenly, or it is previous
Yeah.
pregnancy also she had a high
Even if
BMI.
even if we have not asked, at least ask her what she is doing for the weight loss. What she is doing for the weight loss. Okay. Dr. Divya, don't take it otherwise. Okay, we are here to make you more and more uh, smart. Okay, so that you will not miss out on the important points. Otherwise, very means coming forward and presenting today was a uh, good start. What I will say. Few points, as all of them has mentioned. Why should have been asked in the very beginning. Why keen on home birth, so that your most of the points would have been answered. When it has been mentioned very high BMI, at that point only you asked what is her BMI. It will, because at the end asking that BMI doesn't sounds very good, because how high the BMI is, it will be very good if you will be asking in the beginning. Okay. Uh,
Yes,
then
ma'am.
yeah, then this all those points what we had discussed, small points were missing out everywhere. Okay. Hmm?
Yes, ma'am.
So try to be little more structured and use less sentences. Means the information you have to give more information and small sentences. Here what used to happen, you were repetitively giving the same information and big sentences were using, and that might be the reason why you lost on time. The time management was not
Yes,
proper in the beginning. When you started introduction, aim, setting agenda, when you start your history, his that time it was already 1 minute 25 seconds when you asked me my first question. So this can be cut short. This can be cut short. Use small sentences. Start history taking very early. Start history taking very early. So, and your information gathering was went on till 6 minute 30 35 40 seconds. Last 2.5 to 3 minute you had to complete the task. Okay. Always remember that your history taking should be concise enough to be completed within 4 minute 30 seconds, so that you are having ample of time to address the concerns. And in although this is seems to be a this is something like a hidden task. Okay, here the BMI is high, the safeguarding issues are there. So always see whether it is safe to see the patient is not having any social support. The patient is not keen on continuing getting pregnant, getting continuing that. Apart from that, there is this that safeguarding issues. So it is an early pregnant presentation, so you can very easily touch upon, are you really keen to go ahead with the pregnancy, or since you are not keen, would you like to discuss the option of termination? And if she's showing any tantrums, anything, if you think, please say sorry here. Oh, I am really sorry if I have hurted your feeling. Okay, if the patient is saying all those tantrum, but it is always
yes, ma'am.
better to be safe in the task. So situational awareness, non GP referral. It was not midwife who has referred her, it was GP. Okay, you mentioned about the midwife. GP referral, high BMI. In the beginning only, if it has been mentioned high BMI, I will take an efforts to ask what is her BMI. Hmm? Ask as
Yes,
not
ma'am.
mentioned. And here only you can ask, is she taking any measures to minimize her BMI? Okay, minimize her. Why not under midwifery care? Then I am having multiple concerns which I had mentioned. Uh, Pregnancy details, open question, planned, unplanned, contraception, menstrual history, irregular, and that's the reason early dating scan can be offered to her. Mode of deliver, previous pregnancies, I mentioned maximum things. Accessing case detail, okay, accessing case details was not mentioned. BMI 55, treatment tried, weight lost, sensitively, advise sensitively. Okay, so this you have to advise her sensitively. Weight loss, not now, not now, but once you done your pregnancy, once the outcome of this pregnancy will be completed, once you deliver this baby, we will recommend you to lose weight by offering you a weight management clinic referral for, means you will, they will be assessing and then they will be seeing how to manage this weight. Okay, so that one point is very important. Very high BMI, very 55 is very high BMI. Up to 40 still it is okay. Asthma controlled, you asked me. DM, high blood pressure, blood clot, you asked. Family history of clot, you asked me. I didn't listen that. Support, you asked.
Yeah, ma'am.
Okay, support, you asked. Surgery, allergy, you asked. Okay, allergy, you asked, and I mentioned that I do not have any allergy. But asthma, when you went, here again you started going into the detail of asthma history. See, when I mentioned asthma, it is controlled, nothing, means I'm just taking pumps. You just take it, that is because your task, main task is obesity. Don't go into that subtask, asthma. If it is controlled, accept it, it is controlled. I'm on regular follow-ups, I am on regular thing. Don't go, when was last visit, when was last attack. See, your main task is obesity.
Yes,
Smoking,
ma'am.
you offered me, and I also mentioned one very good sentence what when I mentioned, but my husband, my partner is smoking a lot. Then at that time you appreciated me. I appreciate you for quit smoking. See, the sentence use of saying that sentence should be very appropriate when you want to say that sentence. Okay, so do not, because I mentioned that sentence and immediately you offered acceptance. No, you just acknowledge, okay, so your partner still smokes, so you are at risk of indirect smoking. Even if you quit smoking, you are at risk of indirect smoking. So very nicely then you mentioned that you can come up next time and we can see you together and we can discuss the ill effect of smoking on the newborn, okay, or the fetus. So you can bring your partner. That was a very good sentence what you mentioned after that. Then partner's view support hint of abuse. Okay, so I had given you quite a lot of hint. You can here again you can mention if she feels safe, she's at risk, is there any harm, can I offer you safe, means I may need to involve safeguarding here. Safeguarding is not an offer, it's an important recommendation. Offering is sometimes whenever you means here you can offer her consultant led care unit booking, you can offer her termination, those will be offered, but safeguarding will not be offered. Safeguarding is patient safety whenever any baby is at risk of child safeguarding. Basically if any child is at risk of any abuse, you have to offer them safeguarding. Okay, you have to recommend a safeguarding, child safeguarding involve, you have to first inform your consultant and then the child safeguarding. So now check her knowledge, what is the her views on pregnancy and high BMI. So yes, it's an high risk pregnancy because of very high risk BMI, high BMI. Consultant led care booking, nurse specialist, midwife, GP, nutritionist, dietitian. Weight reduction not advised but restricted calorie. Okay, so her calorie count will be restricted so that she will not gain extra weight during pregnancy. Implications you had mentioned most of them. Okay, miscarriage early, so we will be going ahead with early USG. Difficult to see the baby because of this big means fat tissues. Not, don't say that fat tissue, but yeah, it will be difficult to access and see the baby all on the ultrasonography also at a time. Okay, so this there might be difficulty in having a detailed anomaly scan uh, because of the body structure. Okay, then the patient is at risk of high blood pressure, diabetes, blood clot formation, and the risk will be every time whenever she will be there, we will be always assess, and the low molecular weight heparin or blood thinner agents will be offered to her once she get admitted, because risk is very high. Even if it is vaginal delivery, she will be offered low molecular weight heparin during the labor time. Okay, so she will be offered definitely. Down syndrome risk is there compared to the general population because of the obesity, also because of her age, also the baby might have some abnormal formation of this neural tube defect, and that's the reason for this folic acid will be offered to her at a higher dose, that is 5 milligram, which you had said. Aspirin, low molecular weight heparin, and vitamin D will be offered to minimizes the risk of preeclampsia, that is high BP, low molecular weight, and vitamin D. This all will be offered to her. At the same time, because of her high BMI, there will be problem with the equipments and problem with the handling. So these needs to be ensured, that we need to be ensured that whenever she will be booked, this kind of instruments will be available and the handling personnel will be trained enough to uh, tackle this situation. Okay, so this is one of the very important patient safety point with this baby. The baby is at risk of miscarriages, growth abnormalities. Monitoring will be done on the ultrasonography because abdominal monitoring is not is means not possible to do in her case. During labor, she will be offered continuous fetal heart rate monitoring. The babies are at risk of childhood obesity, asthma, and yes, one of the risk in obesity is stillbirth or the baby dying inside the womb. So these are the risks associated during antenatal care. During labor, there are chances of having difficult or prolonged labor intervention. cesarean section, shoulder dystocia. So we need to offer a IV can or IV line throughout the labor procedure, continuous fetal heart rate monitoring, access to an IV line, okay, that is vessel, blood vessel, anesthesia review, and we have to withhold low molecular weight heparin during labor, okay. So with all these problems, it is very difficult to offer her midwifery layer booking and a home birth. Okay, when she says that the baby is at risk of abuse because of the partner's drug addiction and alcohol addiction, so offer addiction de-addiction services to partner also. Safeguarding is very important, especially child safeguarding, which you had mentioned. Frequent visit, frequent blood test needs to be done. She needs to offer diabetes screen at 24 to 26 weeks of gestation, and from 24 to 26 weeks of gestation, she will be offered ultrasonography fortnightly till delivery, and she will be booked under consultant led care unit. Post delivery, she is at risk of depression, so support is very important. She needs to arrange a support option, and in a when we up now we had explained her all the risks. We had come up with her explaining that abuse history also. So in all the above things, we can just tell her one point. In view of above risk, will you be okay to continue, or would you like to reconsider the option of ending, as you were not keen on this pregnancy? And if I have hurted your feeling, I'm really sorry for that. Do you need any help for the same thing? Okay, do you need any help? I will be in, do you means I am worried about your safety, do you feel safe? Okay, so those are 2 3 sentences which you are going to take here. If that is a abuse task, then you might guide it on a proper channel. Okay, with these things, you can arrange early scan, all booking blood test, follow-up appointment with the consultant, document her care plan, involve safeguarding if there is any ongoing threat, patient information leaflet of obesity in pregnancy, and you can arrange another follow-up. Okay. So information gathering is high BMI, family history of obesity. Here the family history is of everybody is obese at her family. Irregular period, previous failed epidural, lack of appropriate prophylaxis for spina bifida. Okay, she is not taking, she is taking, I mentioned about folic acid. Okay, so you can say that I am taking. Desire to have home birth primarily because of fear of her children, that is domestic violence. Asking after domestic violence and potential child safety issues. Okay, you can probe little more here. Communication with patient and families. Explain the plans at this visit. Book ultrasound scan to date pregnancy, confirm viability, determine number of fetuses. A need for basic blood investigations, that is booking blood test. Okay, implication of high BMI on screening, monitoring of BP, anomaly scan, and FHR. Plan of care including regular visit. Sensitivity about smoking and alcohol, screen for gestational diabetes, discuss about delivery where this will occur, acknowledge the issue of alcohol and smoking. Importance of continuing with medication throughout the pregnancy, folic acid 5 milligram until 12 weeks. Discuss prenatal screening, monitoring of the fetus, timing of mode of delivery depends on mode of previous baby, state of perineum, vagina, vaginal delivery anticipated. Okay, so she can go for vaginal delivery. There is less likely she may landed up in cesarean, but aim for vaginal delivery. But these are the associated risk factor which may she may land up in cesarean section. That also we need to explain her with obesity, because protracted prolonged labor may landed up in cesarean section. Communication with colleague here, dietitian, anesthetist, staff about equipment. Okay, referral to staff about equipment and lifting, etc. Safeguarding of children and patient because of domestic violence. Safe prescription. Weight loss is not recommended, but dietitian reference to have a healthy, adequate diet, group and group activity. Okay, she needs to be motivated, keep hydrated, keep mobile. Allergy, asthma. Discuss termination if patient is not keen. Discuss contraception. Continue folic acid 5 milligram, vitamin D. Offer counseling for the same. Safeguarding of child patient. Identify abusive relationship. This is patient safety. Okay. Applied clinical knowledge supplemented with vitamin D, increase folic acid to 5 milligram daily, multidisciplinary care, risk assessment of PT, thromboprophylaxis, antenatal and postpartum, understanding of issues of safeguarding children, demonstrate the use of guideline to inform decision on treatment, NICE and RCOG Green Top guideline. Okay. So a good attempt by you. Anybody is having any question, any concern? No?